everyone, and this is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Bright Spots Ventures. We bring leaders together each episode to not only inform all of you, but also unearth bright spots, successes at health plans, hospitals, and other healthcare-related organizations. Our goal is to identify as many of these bright spots as possible so that you can determine if the ideas shared during this episode can be applied at your organization. We believe that this approach of finding a bright spot and cloning it is the most effective strategy to improve healthcare in our lifetime. If you're listening or watching us for the first time and you've not subscribed to Bright Spots in Healthcare, wherever you like consuming podcasts, YouTube or any of the podcast apps, Apple, Spotify, et cetera, stop what you're doing right now, type in Bright Spots in Healthcare and click on subscribe. That way, if you can't attend live when we record via webinar, you get every episode on Tuesday downloaded to your device where you could get access to great ideas, thought-provoking strategies and insights from the incredible guests that we're so privileged to have on our show each and every week. And if you're so inclined to give us a 5-star rating on that podcast app, and maybe even write us a testimonial, that would be great too. That allows all of your peers to find us more easily. Recently, we got this one. Your programming is more useful than 99.9% of the traditional online content out there. Thank you. And that is from the CEO at Cortex Analytics. I don't know, 99.9% is validated, but we are proud of the guests and the content we do put out there. Speaking of which, our topic today is innovating product design for growth and member engagement. I get the privilege of prepping individually with each one of our guests. I could tell you this episode is going to be a really good one with some really interesting insights and ideas. So I'm really looking forward to it. We are going to post the bios of aforementioned guests in the chat and in the show notes, but I will be introducing them by name, title, and company in just a moment. Our sponsor for today's episode is none other than TytoCare. If you haven't heard of them, and hopefully you have, they're just reinventing the next phase in what we call virtual care or telemedicine. They have been created to help families just around the world who are faced with challenges accessing medical care, primary care specifically. They work with health plans to reduce total cost of care, improve access, and also create a great member experience. They also help create a great provider experience for those doctors that you contract with who are taking care of all of your members. I'm going to tell you a little bit more about them later on in the episode, but if you do want to check them out, they're at TytoCare.com. That is TytoCare.com. All right. The all-star group of guests that we have in front of you. Can't wait to get to this. So we have Maria Baker. She's the VP of Health Strategy and Delivery at Highmark Health. Welcome, Maria. We have Lena Pearlman. She's the VP of Medicare Product Operations at Scan Health Plan. Good morning over in California, Lena. We have representing the greater Boston area where I'm from, Roni Mansur, Vice President of Product Management at a little-known organization called General Brigham Health Plan. And we have Suzi Pigg, who's the Vice President of Payer Strategy for TytoCare. This is what I've done, folks. I've divided sort of the show into 3 segments. I sometimes like to do that so we have a nice flow. We're going to start with product strategy, then transition into plan and product design, and then get into sort of member activation and engagement and member feedback and what that means for your product design. So it should be a really robust and hopefully very integrated conversation that allows you to come up with a lot of different ideas here. So get your pen and paper ready or start typing because there's going to be a lot of good takeaways. I'm going to start with you, Roni, not because I'm biased because you're New England, but because I thought we could set the stage and talk a little bit about strategy and how some of the challenges here around product design and from the health plan perspective is we need to understand like what the overall mindset is of all of you who are in leadership roles in product and innovation, because launching an innovative product in our industry is not easy, and ensuring the market is also ready for said product is also not easy. So Roni, how do you determine when the timing is right for a new product and what strategies have worked to align innovation with what the market needs?
Thank you, Eric. First of all, appreciate you having me on the program. Very excited about this to both share a few thoughts as well as to learn. I think as product leaders, what I would say is we're all aware of, maybe have been involved in products that were great ideas on paper, but we just didn't make it work out. It just didn't fit. Either there was no buyer, there was no customer, the timing was not right. And so I'm big on process. And when I look at the product development process, I tend to over-index on three things. The first one is timing. The second one is product market fit. And the third is customer feedback and validation. And so let me sort of double click on each of those. In terms of timing, I tend to think of three time horizons. The first one is really the here and now, the immediate need that we have, the things we have to do to keep our portfolio robust, competitive, and relevant in response to what our clients need, what the members need, what competitive threats are coming in, what opportunities there are, what changes there are in the ecosystem. So that's I've been telling Eric, that's the keep my job part of the business. I've got to stay here. I got to be relevant both for my business. And that's the first time horizon. The second one, and particularly because I'm at Mass General Brigham Health Plan, which is part of a larger care delivery system, Mass General Brigham here in the Massachusetts area, is really trying to figure out how do we build strategic partnerships with the healthcare ecosystem? How do we integrate with providers and the care delivery side of things? This tends to be a little bit more difficult, require different muscles, require different skill sets, takes a bit more time, and it requires threading a lot more needles. But I think it's a different piece that I think about. The third piece that I think about is really trying to make sure that the things we're building towards fits towards a future-focused vision. So, my personal belief is we are going to start shifting as an industry from sick care to well care. Not completely eliminating sick care, of course, but really the proportion of the spend that we have currently on sick care versus well care is going to shift. And so really thinking about the things we're working on now and the capabilities that we build now to be able to capture those benefits in the future are really important. This is an area which I found is very difficult to get buy-in from a lot of folks because all the focus is on the here and now, right? It's on the first bucket. But I think as product leaders, it's very important for us to push our organizations to keep that eye to the future and make sure we're making those investments. Now, if I shift that's the timing piece. In terms of product market fit, what I would say is that we are laser focused on a rigorous customer feedback and validation process as the way we get to that. None of this is rocket science, but it's really about process and method is the way I think about it. And so what I would really call out is frequency, trusted partnerships and relationships, and validation. So what do I mean by that? So frequency is really all about the number of touches we have with the people who are providing feedback. So we go out, we talk to our brokers, our consultants, the distribution channel. We talk to our employer groups. We talk to our members. We talk to each group probably about 3 to 4 times a year and get feedback from them. The frequency does a few things, right? The frequency basically helps us stay in touch with the market. It helps us also get volume of feedback, which we can get to process. But it also does this other thing, which I've learned is if you are consistent with it, it actually builds trust with certain people who give you feedback over time. And there is a difference between trusted feedback and just random feedback or point-in-time feedback that I've learned. And the trusted feedback can really help make a difference in the next step, which is validation, right? Which is you've got an idea, you've got a concept, it sounds great. How do you then validate it to make sure that it will actually, serve its purpose, bring some value, and ultimately, as a business, be sold and be able to make some money while providing that value. So really that whole cycle, I think, is important. So anyway, Eric, just to wrap up, I would just say, my thinking, the way I approach it is we really measure and we measure, and then we check our measurements again before we make a cut. We leave a lot of tape on the cutting room studio, but on the studio, but like, I think it's worth it to go through that process to make sure that we bring products of value and not just the next bell and whistle that's out.
Great stuff. And I want to make sure I got that right in the summary. You mentioned three things at the top, and I want to make sure that I didn't get blurred by like all the subsets you put in there, because this is really valuable. Number one was timing is everything.
Timing, product market fit,
Number
and
three.
customer feedback and validation.
Got it. Got it. That's why I said. That's why I wanted to get the clarity. And we're going to cover some of that later on, also in the episode. So great stuff. Let's go to the other side of the country now. And Lena Pearlman, VP of Medicare Product Operations at SCAN. They're obviously a Medicare Advantage plan that are in multiple states. Lena, how does the team at SCAN determine when the timing is right for a new product, and maybe what strategies have worked to align innovation with market needs?
Thanks so much, Eric. And, I'll echo a lot of what Roni said. He's kind of thinking the same way that we do when we evaluate kind of our approach to strategically designing and implementing plans. I'll tell you, we're really excited over here. I'll humble brag for a second. We're nearing a very big milestone for our organization, which is almost 300,000 members. I started when we were around 80,000, so it's a big deal for us. It's a big deal for me. And the way we approach our strategy, it really supports our growth trajectory. We take a really disciplined approach to determining when the timing is right for a new product by balancing things like member or prospect demand, market trends, financial sustainability. We all know we've been in this industry long enough. It's pretty volatile, and the Medicare landscape is evolving rapidly. Beneficiaries, consumers, they want more choice. They want more supplemental benefits. They want lower copays and premiums. But of course, we all face kind of the regulatory and reimbursement pressures, and we can't simply just keep adding. I think that those days are well behind us. Myself in particular, scans in very competitive Southern California markets. So instead of kind of just giving everybody everything, our philosophy is to design benefits that really matter, ensuring a strong product market fit without kind of overextending our resources or introducing benefits that we don't think are going to drive the true member journey that we are trying to get, or the real member engagement that we're anticipating. For us, one of our biggest challenges is prioritization. So we see many plans offering a broad range of benefits, in particular supplemental benefits. But as I mentioned, and many of us are well aware, CMS reimbursement changes, the Inflation Reduction Act, the IRA, the era of giving everyone everything is kind of behind us. So our focus on sustainable and scalable benefits that can provide and support towards that member journey is what we do. So we focus on a couple things. One is consumer-centric design. We analyze utilization patterns. We look at social determinants of health, SDOH. We get direct member feedback as well, like Roni, throughout the year, not really only brokers, but members, but also our brokers as well. So we can identify what benefits are essential versus what sounds good on paper and maybe doesn't get used quite as much. There's a lot of that out there too. We kind of call them those gimmicky benefits that maybe don't get used, but kind of have a lot of flash. Of course, you have to be, create products and benefits that are competitive and commercially viable. So it's got to not only be attractive, but it has to be scalable. I'll give you an example. Dental is the dental benefit, a routine dental benefit, not Medicare, not a Medicare dental benefit, but a routine supplemental benefit. It's a top priority for consumers, but it is notoriously difficult to structure and get right without a lot of member friction, abrasion, grievances. So for us, the question isn't just can we offer dental, but can we offer it in a meaningful, competitive, and sustainable way for our members to access? We look at data to drive the innovation. leverage analytics, as most of us are doing, segmentation, looking at risk, looking at who has chronic conditions. And then, of course, the timing is critical. A little bit, as Roni had indicated, you kind of have to live in multiple years all at the same time. You got to live in today, which is 2025. You're barely getting into 25. You're looking at 26. And if you're really good at your job, you're looking at 27 as well. So timing is a little bit of everything, and you got to get your organization behind you to ensure that you're always looking forward for not only really the competitive edge, but making sure you're meeting the market demands as well. So I'll tell you that I think our strategy isn't essentially to just chase trends, but we need to lead with precision decision making. And that really does mean we're continuously refining our benefit mix. We go out, we try one thing, it doesn't work, we take a step back and we say, okay, what did we do wrong? What could we do different? And how do we make more impact the next go around?
Good stuff. So one of the things I wrote down design benefits that really matter versus giving everyone everything. And I couldn't help but recollect, I think from the Steve Jobs book, when he said, some people say give customers what they want, but that's not our approach. Our job is to figure out what they're going to want before they do. It seems like it's kind of not exactly, but sort of the same approach at Scan, at least right now, as you're thinking about this new world and how to make sure you're creating fiscally viable markets.
Absolutely, Eric. I mean, no doubt.
Yeah. I also like don't chase trends, precision decision making. I love that as well. Wrote that down. Incidentally, I'm writing down a lot of stuff. I do this every show. It's one of the reasons I love doing this, and I've been doing it as long as we have, over 11 years now. If you want a copy of my unabridged notes that I'm typing in color coded and everything into a Google Doc right now, if you want that, I'm going to ask you the favor of in about 45 minutes, a little bit less actually, when you get another email from me, that you don't mark it as spam, but you actually click on it and take the survey. It's a 2-minute survey asking you for feedback. And if you are inclined to take some of the optional open-ended answers, it may take you 2.5 minutes to fill out, and we'll know better on what to cover next year. So please take that time. And anyone that does that, you'll get my phenomenal notes, and you can make fun of all my spelling. All right, we're going to transfer over to new plan design. I want to get into that. I think we have the stage now set, and we're going to bring in Maria Baker, who's the VP of Health Strategy and Delivery at Highmark Health. Maria, health plans have invested a lot in niche products and products that leverage digital benefits in one way or another. But designing a digital kind of benefit program is a pain point. And how do you provide a seamless member experience? What approach has Highmark taken, and what lessons have you learned in embedding virtual and digital care into a broader care journey for your members?
Yeah, I think the biggest thing is that we didn't tackle it with the idea of how do we get virtual care worked into the strategy. We ultimately looked at how do we converge all of the pathways that help people find care and make them as consistent as possible, and make sure, frankly, that all roads lead to Rome. So it doesn't matter if you come to our digital experience looking for care or if you are there for another reason. The pathways that get you to understanding what your care options are and what modalities are available to you are all the same. So you can be actively clicking on the Get Care app, or you can be in our chat experience and happen to mention that you're not feeling well, and the symptom checker experience will take you to how you can get care. Where the virtual layer comes in is, as we were designing that sort of converged care journey map, we ultimately said, we've never really had an embedded service in our digital experiences, whether it be our member portals or our new standalone app, that offered care. It was always a how do I find care? How do I get care? And so it was important to us to create a white labeled, fully embedded, I'm already here, how do I click and actually get my needs taken care of? And so we do have urgent care and primary care and women's health and dermatology options that can all be serviced seemingly while you're in the app. It is certainly with a partner, and you are in a different non-Highmark owned entity, but it doesn't feel that way. And ultimately, because we started with make care as easy and as accessible as possible, we didn't start with a how do I get more people to use virtual care. It really did turn into some very meaningful customer behavior change. We launched the new fully embedded available virtual care options in the beginning of last year, beginning of 2024. Without any marketing. We just really wanted to understand, are the pathways working? Can people find their way here? What does that look like? And we had 20,000 users within a little past the first quarter with no marketing. And that was a big symptom check to say, yeah, you know what, there was a need here. We are scratching an itch that people did not know about, and it's not downloading a new app. We can retrain consumers to expect different types of offerings when they're in our digital experience. And, you know, it's continued to be a success. We will still pull traditional marketing levers and always will, but it was important for us to understand the consumer behavior journeys and what we were building was actually going to work.
That's awesome. That's great. And I know I've had some of your colleagues on the show in the past talking about the build and how hard that is.
Yeah.
I love that. I'll call it convergence care, stealing a term I think you used, and just how you embed the virtual option into the experience, but it's more about finding the care, and then the preference of how the member wants to receive that care is up to them.
Yep.
I love that. You know, I'm bringing in Suzi Pigg. She's the vice president of payers for TytoCare. You know, Suzi, we seem to be at this crossroads, right, of digital and virtual care, where we've been in like 1.0 for some time, whether it be for acute needs. Some companies were doing some longitudinal needs, but we're still doing a lot of the same modality. I'm wondering now, like, is the market now maturing to, let's say, these are my words, but heck, 2.0, and maybe share an example of how maybe a pioneering health plan is innovating around digital and virtual, and what, like, I'm referring to as like the next stage of telemedicine, a 2.0.
Yeah, so I'll stick with your terminology because I think it's a good one with 2.0. And I think, you know, when we think about virtual care 2.0, you know, sort of what you were alluding to as well in the line of questioning is thinking more broadly and at a higher level of, you know, what type of care do people need and what type of care can people consume virtually, and not just being, you know, focused on specific modalities or specific, you know, chronically complex members. You know, more specifically, to answer the second part of your question about a health plan example, this is a national payer that's a partner of ours, and we saw them achieve pretty amazing results in reimagining how they could further leverage technology to bring more sort of integrated, holistic 2.0 type virtual care into the home. And it's really, you know, leveraging technology to make it more seamless and more convenient and more valuable beyond, you know, what I would call 1.0, which is the basic FaceTime call, right? Where you're limited to that sort of audio visual setting type of engagement between a provider and a member. So we partnered with this plan and their telemedicine vendor to not only amplify, but also be able to scale what can be offered in the home. And I want to highlight just a couple specific results we saw from that program. So 90% of members use Tyto in replace of going to an in-person visit. 81% agreed that Tyto was in fact a more convenient option for being seen for whatever condition they were being seen for than going into a brick and mortar setting. And overall, we saw, you know, roughly an 8.5% reduction, or translated into dollars in member units, $21.60 per member per month on the impactable costs that we measured with that program, which of course included, you know, what I would say are sort of the basics and what we hear in 1.0 today, which is urgent care avoidance, but also replacing both primary and specialty visits and reducing unnecessary, you know, follow-ups for things like labs and radiology. And lastly, I'll just add that our takeaway from that example is that solutions that are not only high value and high convenience to the consumer, but also good for the partner, the provider partner, and that they enable them to practice more effectively and a higher level of quality in that virtual setting, while also still meaningfully and significantly addressing the total cost of care objective that we're all after, right? And so highlighting solutions and products that can create that win-win-win equation across the health plan, the provider, and the member is where I think we see, you know, the strongest adoption and ultimately, you know, significantly greater success with virtual care 2.0 strategies.
Got it. So I just want to summarize. So we have a national plan. They want to sort of raise the bar in virtual care. So they go 2.0. They tell their virtual care telemedicine provider, hey, we're going to do a program that's going to enable your physicians to get much more data and do a much more thorough exam. Then they work with a company like TytoCare to get like a device into the home that's inexpensive, but still allows the physician remotely to get all kinds of extra data to really replicate an exam versus just having, as you call it, a FaceTime visit to take it to the next level.
Right, exactly.
Yeah, that's great. I think one of the challenges, right, we all, everyone listening who represents a health plan faces is like reducing this total cost of care while improving access and quality. That's going to be an ongoing theme of the conversation today. And I think there's going to be all different cool ideas. But if you're looking for real world data and want to see some more examples of what data looks like when you try to implement, again, my words, a 2.0 strategy to your digital telemedicine kind of strategy, we have a case study that explores how to reduce unnecessary urgent care, unnecessary ED, and unnecessary PCP visits by improving diagnostic accuracy and cutting total cost of care. And so I'm going to have Jess Tenzer put up a poll. If you want that case study, it is authored by TytoCare, but it is filled with data and allows you to kind of think through your strategy and maybe steal some of that stuff for your business case moving forward. I wanted to make sure we offer it up to folks, and I'll send an email out, or someone will on our team, so you could get it right after the show. I want to go back to the West Coast now, and Lena Pearlman at SCAN. How does SCAN, Lena, approach just product development and thinking through sort of, you know, as you mentioned earlier about making sure you scale down and prioritize the benefits. And you also mentioned sort of precision decision making. And when you're thinking about precision, not so much like precision medicine, I don't want to misstate it, but like really targeted products, niche products.
Yeah.
How do you go about like thinking about those, designing those, and maybe talk about some of the biggest challenges you guys successfully figured out to successfully launch niche products?
Yeah, thanks. You know, it's an interesting question. I mean, of course, for any Medicare Advantage plan, you're going to have your standard workhorse plans, your kind of general enrollment plans that are going to be the bulk of your enrollment. And you're going to make some changes that meet market demands. But as I mentioned before, you know, one size kind of doesn't fit all anymore. And so what we've been doing on our side is really taking a tailored product approach to make sure that we can identify niche populations or niche products that address very specific needs for very specific populations, including health needs, cultural preferences, access barriers, like seeing the right physicians, whether it's based on language preferences or based on affirming care. And a lot of this requires more than just kind of like making sure we have materials that are in Spanish or making sure we have materials that are in, you know, translated in Mandarin. It's really kind of designing an ecosystem where our membership feels seen, understood, and supported. So what we do is we have, you know, used a word, niche products. We call it tailored products that focus on populations like an ethnic community. We have a product called Scan Aligned. We have a product called Scan Affirm, which is the first LGBTQ plus product, Medicare Advantage product in the nation. And interestingly enough, you know, there was some skepticism even from our own organization on the growth of a product like this. And look, it's not like we're getting 30,000 members on Scan Affirm, but we started with 200, and 2.5 years later, we're, you know, almost at 2,000. So on products like Scan Affirm, Scan Allied, and thirdly, we have a product called Scan Inspired, which is focused specifically on the needs of women.
Lena, what is Scan Allied, real quick?
I'm sorry, Scan Allied is our product that's focused on our Asian communities in our kind of core markets in California. And so all three of these products, again, it kind of fall into that niche tailored product. And what we do is a lot of kind of market research and due diligence first and foremost to make sure that we're launching a product where we know what the demographics need. We know what the claims data shows us about these populations. For example, what prescription drugs are they using? Do we need to adjust our tiers to make sure that we're addressing very specific needs that they might have on prescription medication? We talk and look about what are the access to care barriers. So is it language? Is it, so maybe for an Asian population, we need to ensure that we've got a network of providers who speak in language and are trusted partners in the community. For our Affirm product, we needed to ensure that we had a network that had vetted and affirming providers. So we went through an extensive process where we conduct and we do an ongoing a survey to ensure with an external partner to ensure that these providers can actually provide the care to these members in an affirming and in a culturally appropriate way. We also make sure, like I said, that we're partnering with the right networks and groups. We build these very deep relationships, and together with our team and these provider networks, we build an end-to-end journey, not only from the health plan experience, but from the healthcare experience, so that the first time a patient or a member enters kind of our collective product or our ecosystem, they're feeling like they're entering a product, a world, a benefit plan, a member service experience that resonates with them. And, lastly, we also look very much so at pharmacy networks. It's interesting, I think we all know this anecdotally, but we see it so much day to day that pharmacy networks and pharmacists play such an important role with these populations. So I'll give you an example. For our Scan Allied product, we ensure that we have a pharmacy network that includes all of the local mom and pop Asian focused pharmacies that you wouldn't normally have. You've got your CVS's, you got your Rite Aids, you've got your Kroger's, but we also ensure that we've got a culturally concordant pharmacy network. Of course, that primary language is very important to many of these individuals. So, for us, it's the approach is make sure we identify the population, do the research, make sure we've got a true end-to-end experience. And then, of course, you want to make sure that you're balancing this ability to access the healthcare system with affordability and ensuring you're granting people not only access to providers, but making the care affordable to access as well.
Great stuff. I love that example and those stories. Staying on the topic of affordable but accessible, I want to move over, go across the country over to Roni in Boston. Roni, how is Mass General Brigham Health Plan approaching this balance, and what are some of the core components on your side of, from your perspective, to successfully designing and launching a product that meets those criteria of affordable but accessible?
Great question, Eric. I think about this a lot. What I keep hearing from our market here is affordability and access are the top two things that are on the minds of employers and consumers. And so an example that we have of a product that we recently launched really started, as I think back to it, with the COVID-19 pandemic, which caused many of us to retreat back into our home offices, the Great Resignation. And then what we started hearing from our brokers, consultants, and employers was that there was a little bit of a shift happening. Companies that used to hire locally was just not able to do that anymore. They just couldn't find enough local workers. And so they started having to hire workers in other states. Now, this isn't unique to Massachusetts. I think this has happened across the country. But the effect of that for our employers was many of them were on a traditional HMO plan. And all of a sudden that plan just wasn't going to work anymore. And so they had to add a PPO plan. And a PPO plan, as you know, is a lot more expensive relatively. And they were under cost pressures with, coming out of COVID. And so we really had this situation where we needed to find some solution that would thread the needle of national coverage while really trying to figure out a solution on the cost side. So we came up with a concept for an EPO plan. We call it the Complete Access EPO. It's basically a middle ground between an HMO and a PPO that many of you are aware of. Similar to an PPO in terms of nationwide coverage, the difference being out-of-network care is not covered. And what we were able to do with this construct is really, instead of that 8 to 10% premium difference between a PPO and an HMO, really get to a 3 to 4% differential, which we found was meaningful. So once we had this concept, we had sort of the product concept kind of tied out. We really went through, once again, I'm hearing a lot about the validation among my co-panelists here as well. We went through about 30 to 40 hours of real, deep individual and group feedback with our brokers, consultants, and employer groups. First to even explain what the product is, get them to understand it, take their questions, get their input, and then really ask the question, would you ultimately buy it, and see what sort of feedback we got. And based on the feedback, which was, I think mixed, but generally had enough positivity to it for us to launch this product. We launched it in 2024 in the large group market here. We have seen good traction, particularly, I would say, in the mid-market segment. And so after some time with that, we've also launched it in our small group market as of this year, and seen some traction, particularly among the larger small groups. I would say one interesting thing that we learned, as we were picking up business here, was that a number of the cases seemed to be coming from the national carriers. And so we double-clicked on that and got some feedback. And it was interesting that the employer groups that we were able to talk to about why they switched, one, of course, there was a product that now kind of fit their needs, fit their price point, but they also indicated a preference to work with a carrier that was local, that was present in the local communities, was investing in the local communities, that was just important to them. And so we ended up baking that into our go-to-market strategy. So, I feel like as we think about these products, we launch them, we test them, even post-launch, there is a continuous education. I still don't feel like we have reaped the potential of this product yet, because there is continuous education we need to do probably for the next 2 years on this product to get the word out, to get people to understand it. The first time you present it to someone, they may not be comfortable with it, but I think you bring it up at the next renewal, they'll get more comfortable, and the cost pressures might be a bit higher and sufficient enough for them to get to that tipping point. So anyway, hopefully that was helpful from an affordability and access standpoint. It's more like network access as opposed to, different forms of access. But yeah.
I mean, I'm not going to beat a dead horse because I'm into the numbers today. It's like PPO 3.0. I mean, that's what it is, the CPO product itself. So anyway, thank you. That was great. And I think innovative, and who knows if that ends up being and grabbing sort of as the next evolution of a PPO product, which you guys call EPO, of course. Speaking of numbers, because I mentioned earlier telemedicine 2.0, I want to give one more kind of shout out to TytoCare. If you could replicate the in-clinic experience virtually and then drive higher utilization, reduce costs, and improve outcomes through another evolution of virtual care 2.0, you need to check out our friends at TytoCare's Home Smart Clinic. This enables families, regular families like me, like you, to conduct remote physical exams with a doctor using an FDA-cleared device with AI-powered guidance. It generates 6 times higher utilization than traditional telemedicine, a 10.8% reduction in ED visits, and an incredible consumer experience in NPS, well over 80. TytoCare's redefining virtual care. They're creating virtual care 2.0. And if you want to learn more about how it's could help your members, go to TytoCare.com. Incidentally, those of you know, I spent over 12 and a half years working and running solution strategy at a company called General Health, and have recently left to do this full time. And I love doing this. I love meeting folks like the guests you have in front of you. And I only get to do it because of our incredible support from sponsors like TytoCare. So thank TytoCare and all of our sponsors at Bright Spots for letting me do this every day now for a living. I want to move over to Maria over at Highmark, and let's talk about benefit design and how often, not always, but often health plans are looking at benefit design in silos. And your team has decided to take a much more holistic approach. And I want to talk about what it takes so people listening can sort of grab some ideas, what it takes to design benefits that consider the full picture of a member's health needs while still aligning again with that cost and quality paradigm that we've been talking about.
Yeah, I mean, I think this is fairly recent for us, actually. So what I'm going to talk about is still new, but is working really well so far. Given the environment that we're all operating in right now as an insurance industry, we were spending a lot of time digging into medical trend and seeing where some of the big spikes were from a condition perspective, and ultimately took a step back and said, well, let's put the health at the center of this conversation, even though the cost and the quality that circles around it is what we usually spend our time talking about. And what we did was we cut 4 or 5 of the key trend drivers, the ones you'd expect: oncology, diabetes, joint degeneration, a couple others. And we formulated a team that, instead of just looking at an intervention or a benefit design approach or a med policy change, we took the clinician-led approach and had clinicians sit down and really dig into the journey of somebody who's dealing with one of these conditions and where their main hypotheses were for how we could change the way we wrap our arms around a member who's experiencing one of these conditions as a main driver of their health. And what we do is take those hypotheses, often very extensive lists of hypotheses around a particular condition, and then really build that team of representatives from every lever we could pull to drive value. So there is a clinical intervention, there is a benefit design, a pharmacy representative, med policy team, all coming together to review these hypotheses, first for impactability, and second of all, for how it fits into each other's answers for how we would solve some of these key things. And we use that to really build an end-to-end response to a particular condition and to drive value. And so that allows us then real time to balance the cost drivers, the quality drivers, the prevalence, and make choices based on our particular member population at any given point, and kind of removes that silo approach that you're talking about and forces conversations that sometimes we historically wouldn't catch until the back end when we're ready to launch a clinical program that didn't necessarily have the full thought partnership of the rest of the organization.
Okay, I wrote 3 keys there. I heard clinically driven approach and allowing those clinicians to share their hypothesis and how to best support and treat these members. 2, I heard you're going to measure impactability. And 3, how the approach fits in with each individual team member, the cross-functional team members, what their approach would be, and if there's synergies there.
Yep, absolutely.
It's awesome. I love that. You guys that's just super innovative. Suzi, we're gonna shift actually now into like the final kind of segment around customer feedback and member engagement. And we talked, Suzi, earlier about that national plan and innovating the design of the primary care benefit. One criticism I still hear when I talk to health plans is a lot around how these digital solutions still aren't driving enough engagement or utilization. I wonder if you could just share an example of how a plan or any, for that matter, risk-bearing healthcare organization, so you could pick anyone, are using products to drive and using sort of in-house products to drive meaningful engagement and an increase in engagement.
Yeah, fair question. There's certainly a lot of really good things out there, programs, products, services. And they're not great, right? Until somebody actually uses them. So to answer the question, I want to highlight, this is actually a VBC organization in the Midwest that we have a partnership with. And prior to leveraging Tyto, we did an exercise to baseline where their utilization of virtual care was today. So we looked at claims data from the year prior across about 160,000 members and found that people were going, roughly 55 to 60 virtual visits per thousand. Said otherwise, they had about a 5% utilization rate in their, what, to go back to your terminology, what I'll call their 1.0 virtual care offering to their membership. So in keeping with the hypothesis that if we can leverage technology to create more convenience and value for the member, out of a virtual care interaction from the comfort of their own home, we should see higher engagement. one of the specific program tactics for this partner of ours was to target members who either already were or statistically were very likely to be frequent flyers of ED and urgent care utilization, and clearly weren't already using virtual care since they were only seeing 5% utilization with their in-place strategy. So what we ended up seeing when we introduced TytoCare into the population was an 8x increase in utilization. We went from roughly the 55 to 60 virtual visits per thousand to 426, so 42% utilization. And as a result, we saw the following sites of care substitutions occur in that population. 60% avoided going to urgent care or ED, and 36% actually avoided brick and mortar office visits because they were able to leverage the technology to replicate what would have otherwise traditionally had to occur in that brick and mortar setting in their home. And we did this analysis, what we call like a diff and diff analysis, where we look at a cohort of individuals who have access to virtual care 1.0 and a cohort of individuals who have access to 2.0, which is, virtual care plus Tyto. And everything sort of from a profile perspective about those two different populations is otherwise as closely identical as possible, so that really what you can hone in then on the one variable between the two populations being Tyto or no Tyto in the virtual setting. And so one final point just to add to that too, that I think highlights the effectiveness of the solution, which is ultimately, where the convenience and the value for the member comes from, is we saw, we see, generally speaking, more broadly across multiple of our programs now, not just this one specifically, a 59% increase in what can be diagnosed in that virtual care setting. And we see 98% effective resolution. So what we do after somebody does a TytoCare visit is we look at claims data for usually about 10 days to make sure that that person isn't doing that virtual care visit with Tyto, but, 24 hours later or 72 hours later, whatever the case may be, still showing up, in urgent care or in the ER complaining of the same issue.
It's great resolution rate. I want to talk a little bit about chronic in a second. I'll come back to you. I want to also touch upon product feedback. So, Lena, like, we rarely design a product or solution perfectly the first time. So, given the time parameters that you mentioned earlier about what it takes to run an MA product, how are you guys creating a feedback loop and then taking action on that feedback, both within your Medicare calendar year and then thinking about, the next enrollment period or the next enrollment period even after that?
Yeah, I mean, it's definitely an interesting life cycle within which we work. As I mentioned, and my colleagues here will be very familiar, we usually live in 3 years all at the same time. And when it comes to trying to adjust and make modifications, there's kind of things you can do and identify real time. There's changes you can make for the next year. And then, of course, there's even longer term changes when it comes to kind of vendor substitution and procurement. So, our strategy looks 2 years in advance, but in the short term, we're doing things on a daily basis, like looking at grievances, identifying what members are calling in about through a program we call Voice of the Customer. We're adapting and using AI tools to look at and research and understand some of the call volume. And then that is shared directly with our operational teams who work with either our internal teams or our vendors to ensure that we're shifting and pivoting in real time. So while I can't change an actual benefit that I'm introducing in the marketplace, I can certainly do things real time to adjust and make sure that the benefit has real utility in real time. So an example, we had a big transition. We introduced a flex card. You had a lot of pent up demand from members who are only used to an OTC catalog. And all of a sudden you introduce a flex card, naturally, there's going to be a lot of pent up demand. And as we get into 1/1, all of a sudden you're identifying things you wouldn't have known or thought about or anticipated despite all your best efforts. So there's two trajectories there. You're looking at call volume, you're looking at grievances, you're trying to mitigate the abrasion and the risk real time. And then, of course, I'm planning for, with my colleagues who are my vendors, what are we going to do differently when we reintroduce, change, update this benefit or this product in 2026? And so again, we're looking at and working cross-functionally within our own organization to really help us use data to drive the work we do, not even on benefit design, but also on true benefit utility, which I think is really important for our membership base. It's not enough to just say you've got this flex allowance or you have this OTC allowance, but ensuring members can actually use it is key.
Love that example. Love it. I know we're getting a little bit tight on time here. Suzi, real fast, because you've been the star as far as data points right now. I mentioned to you about sort of where I wanted to go with chronic. So let's take the complex chronic patients and put them to one side. And let's take the folks that you've been referencing who are sort of sick and need either an urgent care visit or a primary care visit, or would have gone to their doctor, would have gone to the ED or an urgent care, and let's put them to the other side. And there's this like middle folks who don't really access primary care, or it's too far away, they're just not engaged, it's too much of a hassle for them, but they're kind of not healthy, and they're on their way to being in that first group of really sick chronic care. Suzi, how do you tell me a little bit about the studies you've done there and what the impact maybe of telemedicine 2.0 can make on those folks?
Yeah, great point. So, if we think about virtual care as we know it today is what I would say being sort of situationally valuable, meaning it does work and it does have value in very specific use cases. What I want to think about as we think about tomorrow or virtual care 2.0 is how do we make it more widely valuable to larger subsets of your membership population, to your point, sort of that middle layer, if you will. So this is an example from an HMO partner of ours. This is actually one of the largest programs that we have in place. We have over 30,000 Tyto devices out in people's homes. And we wanted to create an opportunity for visits to occur in the home that are essentially comparable or better than brick and mortar visits, under the broad umbrella of needing to engage with primary care. And the result was quantifiable success in actually getting people who were otherwise not engaging for whatever reason, access, value, convenience, to use primary care and to better enable, their provider partner to effectively diagnose and treat, beyond, this sort of subset of common conditions that we see falling into virtual care today. And so this was actually a program that was analyzed and reported on by the Journal of Health Economics in July of 2023. And we looked at the claims data over a 3-year period for the treatment group. So again, the group that had Tyto versus a control group, which only had, what we'll call sort of traditional audiovisual only virtual care. And what we saw from, again, thinking about this need to get that middle cohort, sort of that middle tier of the pyramid to engage in primary care is the group that had the device had a 12% increase in the engagement with primary care. And sort of subset to that then is we also were able to show not only did we get people to use primary care, but we got people to use primary care in a virtual setting and not show up in brick and mortar. And we saw roughly a $205 per member per year cost savings on these primary care visits as a result of them occurring in the home versus in the brick and mortar setting. And then on top of that, we saw savings from things like labs and specialty visits. And overall, that came to a 9% reduction in the total cost of care for those for that treatment group that we looked at over that 3-year period. I think there are a couple of keys to that example that made that successful. So one was the device, obviously. We have more than 1.5 million people that are using Tyto today. We have over 40,000 providers on the platform. So the user experience, both from me using it as a mother to my 4 young children, as well as, the provider, we're drawing on significant data points from, significant pools of users of the device today. I would say another one, and this goes back to what Maria was mentioning earlier is when we see health plans integrating this across various member engagement channels. And so that we're, the availability of this and the use of this is very obvious to the member. We do white label it with our health plan partners. So this isn't a separate now member engagement channel you have to manage or introduce to your members. It's an embedded technology under your virtual care strategy that is, presented as your health plan to your member. And then I think Roni touched on this in the very beginning too, which I think is so important to the success that we've seen across some of our programs, which is that frequent and rigorous customer feedback and validation of what we're doing and constantly taking that in to be able to monitor the performance of what we're trying to achieve with this virtual care 2.0 strategy in this membership base and being iterative and adaptable in making changes when we see something not working and not taking too long to recognize the opportunity to improve.
Great stuff. I'm taking notes. Again, if you want my notes, folks, take that survey that's already in your inbox. So I had all the data points here, which I threw into bullet points, but tried and true clinical device was key to this, integrated with all the channels for member engagement, being able to white label for the plan, and then continuous quality improvement and monitoring for keys, taking all this flow as I capture that. Let's get one more in. Care coordination, Maria, across multiple programs with multiple vendors can be really fragmented. How can a health plan, and I know everyone's nodding, I could feel it, all my attendees here. How can health plans ensure referrals between clinical programs work smoothly for both the members and the providers? And what have you guys taken at Highmark to sort of improve this process?
Yeah, given where we are on time, I'm not going to lament the struggles of care coordination because everyone knows it. I think one of the things that we're paying a ton of attention to right now is how do we actually get the disparate clinical programs to refer to each other, not necessarily back to us to help to close the gap. So we do still and will continue to have the option for a need to be identified in a particular clinical program. Our care navigators or our care coordinators, depending on the need, will get that data and be able to connect you to the right thing. But what we're really working with a key select number of partners is how do we get bidirectional data share between them if it's a vended partnership, so that that we can train the clinicians or the coaches or whatever the modality or need may be, aware of what a person is eligible for, recognizing the symptoms or signs that they may need it, and then talking to them about it while they're live in the interaction so that they can say, hey, you're going to get this link, you're going to get this email, this text message, whatever the modality may be, because we really think you benefit from it and it's already part of your plan. We've had a surprising amount of receptivity from some of our vendor partners in getting to that place. Obviously, every vendor is at a different place in their data journey, so it's a little bit of us brokering the technological side of it and how we can use sort of AI-powered support for identifying the need and getting the bidirectional data flows. But I've been pleasantly surprised by how open some of the vendor partners have been to that conversation. And we're starting with 3, but we have a long list of who will follow after we get it right with these first couple that we're doing. So it's back to what we were all saying before. It's all about creating multiple ways to get there and creating it to be so easy that the person doesn't even realize they're going on that journey. They don't have to go search for it. It comes to them.
Great stuff. Incidentally, folks, before you leave, if you're going to Rise in a couple of weeks, March 11th through 14th, and you want to hook up with me, talk about getting on the show, talk about just where the industry is going, my team's scheduled me out for those days, so would love to meet with some of you. We'll put up a poll. We'll reach out to you. We'll try to schedule something out. We can meet face-to-face in sunny San Antonio. I want to thank our incredible panel today. We're in I could go. We need another one. Just to beat a dead horse, we should do a 2.0 of this episode. I really enjoyed all the insights and everything that you shared. To all of you listening, whether you're listening on the podcast or watching live webinar, thank you for tuning in. I say this each and every episode. We produce each show intentionally to make sure that it's time well spent for you. We do not take the hour you spend with us for granted. We know you're busy. We know you should be doing other stuff. And so we hope you use the ideas and bright spots shared from our guests today to inspire your thinking and enhance your company's just overall approach to improving healthcare for me, for you, for our families, for everyone in this country. We produce this show for you to enable you to do things better. Remember, This is your Bright Spots in Healthcare podcast and webinar series. Thanks so much for attending. Have a good day, everyone. Good stuff, everyone. Thank you.
Thank you.
I really appreciate it. Our screen's still up. So just so you know, there's no way of putting like the curtain down, if you will. Just really appreciate it. Roni, I'm sorry we didn't get to that last question. We just ran along. I know. And by the way, I thought about it. Wow, we're gonna have an allied and an ally. But we just
No worries. This was great. Thank you for having me. Appreciate
yeah,
it.
thanks so much. I first of all, I thought you guys, I knew you were going to be great. You were great. That was one of the best sort of production prep kind of cycle I went through this year. I just really enjoyed meeting with each one of you individually and learning so much. So I hope the experience was a smooth one. Kim or I will be sending you guys out, or I shouldn't say that. Yeah, we'll be sending some feedback, but like if you need anything from us, let us know. We'll let you know how the scores were from the show, and Jess will probably do all that for us. But thank you, really appreciate it.
Thanks for having us.
Thanks for your time.
Take care.
Bye,
And
everybody.
I'll send a quick note for everyone so I'll keep in touch if you're so inclined to. All right.
Great. Thanks so
Take
much.
care, everyone. Thanks.
Thank you.
Bye.